Excellent. Welcome, 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 everyone. Good afternoon. My name is Ashley Powdar. A few housekeeping items for you before I hand things off to our speaker of the hour. If you have a question, please do submit using the Q&A function, and please use the chat for any information sharing. So feel free to drop your name, where you're dialing in from, share any links and any resources there. With the Q&A function, we will answer questions at the end of the call. We also have a little poll for you as well to answer, so please do stick around to the end. We all are very comfortable and familiar with Zoom. I want to take a moment before introducing our speaker to thank our partners. We could not do this without you. Thank you to WIP, NextGen, NGLCC, NMSCC, Cameo, Renee, Snabo, and all of the other partners who have made this event what it is today. This is a highly important and relevant topic given where we are with open enrollment. And so we definitely want to thank our partners for helping us amplify our message and for really helping us bring this excellent content to you today. So it is my privilege to introduce today's speaker and my wonderful colleague, Xavier Vaughn. He is AARP's Senior Program Manager for Medicare Education. Xavier is passionate about service and giving back and has a strong background in Medicare education, having had a strong background in implementing new programs at the state and national levels. He's also an experienced public speaker. He's presented at the American Public Association Conference. Xavier was inspired to work in Medicare through his strong family connections, his grandmother, great-grandmother, and all the other strong older adults in his life really pointed him in this life path. He believes everyone deserves access to quality healthcare information. He is committed to helping people understand their Medicare options. Xavier enjoys cooking. I can personally attest he's an excellent baker. But he always finds the hidden gems in his community, and he is very active in his church. It is my privilege to welcome Xavier. Xavier, over to you.
Thank you so much, Ashley. And thank you all for coming today. We're a small crowd, so feel free to put your questions throughout the presentation, and we can stop, chat, and have a conversation about it during that time. We're going to make this very conversational and just have a really good time during this hour that I have with you. So once again, my name is Xavier Vaughn. I am the Senior Program Manager of Medicare Education at AARP within the Caregiving and Health team. Medicare is something that we all go through, whether it's for ourselves, whether we're helping a loved one, maybe it's part of our job that we do, that we have to assist people. And so it is a great equalizer that will impact us all at one point in time or another. And so it's really important to have some Medicare basics under your belt where you can go into situations and be ready and prepared. And so today, our agenda will be Medicare basics, educating your employees on Medicare, and what are some resources and tools that are available where you can help educate them and yourself. So some common question that we get is, what's Medicare, what's covered, what's the difference between Medicare and Medicaid? When should I enroll into Medicare? What happens if I don't enroll? And how will Medicare work with my existing healthcare coverage? So your role as a business owner is to provide Medicare eligible employees with educational materials about Medicare, connect employees with unbiased sources of information, and help Medicare eligible employees avoid enrollment penalties. What is Medicare? So Medicare is a federal health insurance program that is designed for people who are age 65 and up. If you are age 65 and up and you're already collecting your Social Security, then you are automatically enrolled into Medicare. If you're 65 and are not collecting your Social Security, then you have to actively enroll. If you're under the age of 65 and you qualify for disability and receiving that SSDI payment, then on your 25th month of being on disability, you'll be automatically enrolled into Medicare. And if you have end-stage renal disease, and if you are 1 month with end-stage renal disease and receiving dialysis at home, or 3 months in the facility, and also ALS. And so employees' responsibilities, this should all look familiar to you, right? The responsibility to that your employee will have to cover are your monthly premiums, deductibles, co-insurance, and co-payments. All that should be something familiar. Even if they don't know exactly what those terms means, they know that it is a word that they have at least seen. So what does Medicare not cover? It does not cover hearing, dental, vision, long-term care, and foreign travel. Sometimes if you're like a diabetic, there might be some vision that is included. Cataracts is included in Medicare. Long-term care, which is a big shocker to people, is not included. So nursing home care, foreign travel. The only way that it is kind of ever included with Medicare is if you're traveling to Alaska. So we know there's no way to get to Alaska without going to Canada if you're driving, and also if you're just on a border and the closest hospital is in the other country, not in the United States, then you can go to that hospital and it will be covered. So what are the different parts of Medicare? So Part A, this is going to be your hospital insurance, your inpatient hospital care, some hospice and home health care, and some skilled nursing facility care. And do not get skilled nursing facility care and nursing home care confused. Those are two very separate things. Skilled nursing facility care is if you were to go to the hospital and you have maybe you had an accident or you had a stroke and you go get some rehab afterwards. That is what a skilled nursing facility care is, temporary, and it will only Medicare will pay up to 100 days at some point scale or another. And it's also important to note that you have to be admitted inpatient for three nights. You may hear referred to as 3 moons in order to qualify for skilled nursing facility care, and your provider has to refer you to it. So typically there's no premium for Part A. As you know, we do pay a Medicare tax, and as long as you have 40 work credits, you qualify for premium for your Part A. In order to qualify, it does not take very long. It takes about 10 years in order to qualify. I keep saying I'm going to look into my Social Security account to see when I had my 10 work credits. But I think I was around the age of 27 when I had all my 10 work credits. I'm 31 now, so you can see people can get it fairly early in life. And for some reason, say you have a stay-at-home spouse situation, they can draw off from a spouse. If you have a child who's on disability, they can also draw off from a parent. And you also will see that these costs are all saying still 2025. I know we're very close to 2026, but as of right now, the 2026 numbers have not been released. So the deductible for this year is $1,676 for days 1 through 60 of inpatient care. And it's really important to note that the deductible can be applied again for additional hospitalizations. So for example, you're on your way home on New Year, you went out for New Year's Eve, you're on your way home, it's after 12 o'clock, so we're January 1st, get in a car accident, you go to the hospital, you're there for a couple of days, then you have to go back in February. You're still within that 60 days, so you wouldn't have to pay another deductible. But let's say you have to go back in April, then you're going to have to pay another almost $1,700 for that deductible period. Part B is going to be your medical insurance. And how I like to remember that part A is hospital and part B is medical. If you put A and B in alphabetical order, they coincide to their parts. So A, hospital, B, medical. These are going to be your doctor visits. So when you go visit your primary or even a specialist, this is what is going to be covered. It's going to be under Part B. Your outpatient hospital services, your durable medical equipment. These are going to be your hospital beds, wheelchair, walkers, oxygen tanks, and also Medicare approved preventative services. There is a whole list of Medicare approved preventative services that they offer, whether it be cancer screening, smoking cessation, obesity counseling, STI screening. There, the list goes on and on. So your standard premium will be $185. It is estimated that maybe next year it'll be $206. But like as I said, that is just an estimate, and the 2026 numbers have not been released yet. If you have a higher income, you will have to pay a higher Part B premium. So individuals who make 106,000 or couples who make 212,000, you have to pay more. With that being said, someone who makes $1 million and someone who makes $106,000 will not have to pay the same amount. It is a sliding scale. And the annual deductible is $257 per year, and coinsurance is 20% for most services. So what does that mean? It means when you go to a doctor and after you reach your annual deductible of $257, you will be responsible for 20% of that cost. Next, we have Part C, or Medicare Advantage plans. This is what you're seeing all the commercials for on TV right now. I like to compare Medicare Advantage plans to, in this day and age, we love a good bundle deal, right? We bundle our internet, our phone, our cable, all into one comprehensive plan. And that is exactly what Medicare Advantage plans do. They are an alternative to original Medicare, and they're offered by private insurance companies. So your Humanas, United Healthcares, um, and with these Medicare Advantage plans, they're going to feel very familiar because they're going to be your HMOs, your PPOs, just like you get at your employer-sponsored healthcare. And Medicare Advantage plans have to cover everything that Part A and Part B, in most cases Part D, do, but it can also limit your ability to purchase a Medigap, also known as a supplement plan, in the future. The thing about a Medicare Advantage plan is you must live in a plan service area, and you have to use their providers. As you know, with your HMOs, the PPOs, you have to deal with in and out of network, which is what Medicare Advantage plans are. You may have to pay an additional premium, and you have to follow the rules that the company put in place. Next, we have Part D. Part D, or prescription drug coverage. You can remember D for drugs. Help cover the cost of prescription drugs that you may pick up at the pharmacies. And just like with Part C, or Medicare Advantage plans, these are also ran by Medicare approved private insurance companies. And Medicare Part D is a fairly new program. It's only been around for about 20 years. And Medicare itself has been around for 60 years. So people enroll in Part D may have to pay monthly premiums, and these premiums will vary by the plans. The plans vary from state, county. You have co-payments or co-insurance. You have annual deductible up to $590, and people with higher incomes will have to pay a higher premium as well. So this chart does a really great job of breaking down what are your options. You have A, B, and D. Technically, Part D is optional, but you're going to learn a little bit more later on. While even though it's optional, it's something that you definitely would want to pick up when you're first eligible. Or you can do a Medicare Advantage plan, which combines all those parts together into one plan. And the thing about original Medicare, it is a fee-for-service plan. It has Part A and Part B. And what really draws people to original Medicare is that you can go to anywhere that accepts Medicare. You do not have a network. And most providers are going to accept Medicare. You can choose and join a Medicare drug plan for prescription drug coverage. Medigap, or you may hear referred to as a supplemental insurance, It does exactly what the name suggests. It helps fills in the gaps or supplement what original Medicare doesn't cover. Now, with that being said, it still doesn't have hearing, dental, or vision incorporated into those plans. And just like Part D and the Medicare Advantage plans, these are also sold by private insurance companies. And there's up to 8 standardized plans that you can easily compare it from. And the plans are A through N. With that being said, please do not get Plan A and Part A confused. When you hear Part A, remember that's going to be your hospital insurance. When you hear Plan A, you automatically should think of a Medigap plan. And it is really important to buy a policy within the first 6 months of enrolling in Part B. And the reason why this is so important, if you do not enroll during that time, then you may have to go through underwriting, or they'll look at your medical history to determine if you are eligible to be enrolled into that plan. You have to pay a monthly premium, and these premiums can be costly. If you get a top tier plan, which is a Plan G, and with Plan G, they pretty much cover every expense except for that Part B deductible. So after you reach pay that $257, if you were to go to the hospital and have an issue, then you would pay nothing other than that $257 if you hadn't already reached that deductible amount. And that plan can cost you between $100 and $200. So it's also, when I would counsel people one-on-one for Medicare, I would often say, look at your family health history. We're in November, we're in caregiving month. It's also, I believe, health history month. So knowing what your health history is and making the determination on what plan would be best for you, not only now, but in 20 years from now, and what can you afford? Because these are all the things that you need to consider when making the plans. One of the reasons why Medicare Advantage plans are so popular is because they put an out-of-pocket max on it, right? And so if you have an original Medicare with no Medigap plan, then you're going to be responsible for 20% and there's no cap. You get a Medicare Advantage plan, which are a whole lot cheaper than what a Medigap plan would be, then that's really attractive. I also tell people, do you want to pay up front or do you want to pay on the back end? So for example, it may be your monthly total may be cheaper with a Medicare Advantage plan, but if you have a plan with an $8,000 out-of-pocket max and you have something happens to you and you reach your $8,000 out-of-pocket max, then a Medigap, which could cost you $150 or we'll just say $2,000 for simplicity to make it simple, that'd be $2,400 a month, right? So you have to look at what your financial situation is, what your health history is, not even only today, but tomorrow, in order to make a decision on what will be best for you. So the Inflation Reduction Act and what that did for Medicare, there were a lot of improvements that were made to Medicare due to the Inflation Reduction Act. The first being that every Part D plan has to cover an insulin at $35 per month. And if you could tell by how I worded it, you can tell that not every plans do not have to cover every insulin. They just have to have an option for you. So your insulin that you take may not be covered by that plan. So you can either talk to your doctor about going to a new insulin or just don't enroll into that plan and you enroll into a plan that will cover your insulin. There is also access to recommended adult vaccines without cost sharing. And there's also the expansion of low-income subsidy, or you may hear referred to as LIS or extra help. This is an assistance program that is administered through the Social Security Administration, and it helps cover the cost of your Part D or your prescription drugs. And they've increased the income threshold to 150% of the federal poverty level. Now, this I think is the biggest change, and has a big impact on people. Is there's now a yearly cap of $2,000. Next year will be $2,100 on an out-of-pocket max for prescription drug costs. I know so many people have heard of the donut hole that, it's crazy because I think, we all love donuts. And so when you hear the donut hole, you may think, oh, that'd be something good you want to be in. But for Medicare, it is something that you don't want to be in. And so the donut hole has gone away, and there's now a yearly cap of $2,000. Next year, 2,100. And the great thing is, not only is there a cap, you can spread that $2,000 out throughout the entire calendar year. So, for example, if you have a high cost medication and it costs you $500 a month, instead of having to pay that $500 and make that $2,000 at by the end of April, there is now a formula that will spread it out and make your costs a little more even throughout the year, so you don't have to feel that punch all at once. And so I think what I'm going to do now is which I said something different. I see we have a question in the Q&A. I think I'll go ahead and answer it while it's relevant right now. And then since we're so few people here, and then we'll move on. And so let's see. The question is, will we get a copy of the slides? This is being recorded, I believe. And so we will move on to when do employees need to enroll into Medicare? So sorry, let's see. So there's a few different area or periods that a person can enroll in, which is their initial enrollment, which like what we kind of talked about at the very beginning on who was eligible. They have a special enrollment, which is when people would do it if they were retiring, and they have open enrollment. And open enrollment can mean a couple of different things. And so we'll go through all of those. So your initial enrollment period. So when a person turns 65, they have a 7-month period of time that they are eligible for Medicare. And so during that 7-month period of time, it is 3 months before their birth month, and 3 months after. The one caveat would be if you were born on the 1st. My Uncle Charlie, my dad's older brother, he was born on June 1st. And so his birthday would, instead of being in June, would be in May. So it moved up his 7-month period by a month. And remember that if an employee is receiving Social Security, then they will be automatically enrolled. If not, then they can actively enroll or delay their enrollment. And it's also really important to know your enrollment time, because you could end up having a penalty associated with your late enrollment. And if you are on disability due to and get enrolled into Medicare, you also have a 7-month period of time. You think of that 25th month as your birth month. So special enrollment. So say a person is working, they decide that they're ready to retire, they will then trigger a special enrollment period for when they can enroll into Medicare. This period is available to people over the age of 65, whether they're working through themselves or even if they have coverage through a spouse or partner. Open enrollment. Open enrollment is right now. It's October 15th through December 7th, which is why you see all those Medicare commercials on TV right now. And during this time, Medicare enrollees can make changes to their coverage. If you're in a Part D plan, you can stay in that Part D plan, go to a different Part D plan, or decide to go into a Medicare Advantage plan. And the same thing is true, but in the reverse, for a Medicare Advantage plan. You can stay with that plan, go to a different Medicare Advantage plan, or go to our original Medicare and pick up a Part D plan. It is important to note that if you are on a Medicare Advantage plan and decide to go back to original Medicare, that you may have trouble getting into a Medigap plan, and you may have to go through underwriting and pay a higher premium. And then also a reminder that Medicare eligible employees are not allowed to join during open enrollment. And so what this is saying, say if you're working, this is not a time, open enrollment is not a time to enroll into Medicare for the first time. I mean, obviously, people's birthday will fall during this period of time. But if you're new, this isn't a time to start your Medicare. And so you can enroll into Medicare if you miss your initial enrollment period through January through March, and your coverage will begin the first of the following month. It's also really important to know, even if you're happy with your current plan, to explore to see what other options are available out there. Every year, your plan will change, and there are new plans that come into the marketplace. And so a new plan could enter the marketplace and be a better fit for you and your healthcare needs. So penalties. So if you are for Part A, there is up to a 10% increase for a monthly premium for twice the number of years you have not signed up. So if you did not sign up for Part A for 2 years, then you have a penalty for 4 years. Now, Part B and Part D, those penalties will stick with you for life. And you may say, Xavier, I thought you said that Part D was optional. It is optional, but if you do not sign up when you're first eligible, then you will still have a penalty. So, and I just read an article from that ARP or a study that ARP did last year, and it says for people who have a Part B penalty, they pay roughly 27% more every month than a person who doesn't have a penalty. So if we take that, so what did that mean money-wise? We know that that the Part B premium is $185. So if on average a person doesn't have, that is a $50 increase that they would have to pay, monthly if the average is 27%. So with Part B is a 10% increase for a monthly premium for each 12-month period you have not signed up. And the key word there is 12 months. Say you went 11 months and 29 days without coverage, then you're fine. You're not gonna have to pay a penalty. It wasn't a 12-month period of time. You're somebody's favorite if that happens to you. But so every 12 months you go uncovered, you would have to pay a penalty. If you go 15 months, you only have to pay a year. And this, as I said, this penalty will stick with you for a lifetime. Now, Part D is a little different. For every month you go uncovered, you have to pay 1% of the national base beneficiary premium, which for this year is $36.78. When I was counseling people one-on-one, I think this was back in 2018, I was counseling this person and they never signed up for a Part D plan. So from 2006 to 2018, this person never signed up for a Part D plan. So we take 1%, there's 12 months in a year, times 12 years, so 144% is what times the national base beneficiary premium. And that's what this person would have to pay on top of their Part D premium. So you can see where not enrolling and not being aware of enrollment periods can be very costly for individuals. Medicare in your business. So if you are a small employer, which means you have less than 20 employees, then your employees have to sign up for Medicare. And in this case, Medicare would be primary. Now, if you have more than 20 employees, then your employees have a little more flexibility. So you can delay your enrollment altogether, or you can enroll in Medicare. And what most people do, they do a hybrid approach where they enroll into Part A, because you remember Part A is free for most people, and they delay their Part B enrollment. And this just gives you a common scenarios and really break down with what I just said. So if you have a small employer, if you are a small employer, then your employees have to enroll in Part A and Part B. Large employer, you have options, and you can enroll in Part A and Part B during your initial enrollment period. Enroll in just Part A and delay your Part B, or delay both Part A and Part B. And this is just a timeline of events when people should start receiving information in the mail, and other materials. It's really important to know that you'll get a really big, thick Medicare U booklet in the back. And on the back of that book is a really great resource called the State Health Insurance Assistance Program. It has their 1-800 number on the back. So engaging your employees on Medicare. It is really important to have clear and consistent communication, be able to refer your employees to trusted and reputable sources, and educate your employees about Medicare prior to eligibility. So what are some resources? So we have Medicare.gov. And so you can go on this website or call the 1-800 number. And don't fret if you forget that 1-800 number. It is fairly easy to remember. It is just 1-800 Medicare. So you don't have to know the 633-4227. No, just remember 1-800 Medicare. You'll get there. Medicare is a great resource, especially right now during open enrollment, when a person can go and create an account. And from there, they can select if they want to look at Part D plans or Medicare Advantage plans. And you can shop around, see what plans are available for you in your area. And it's also, they'll have a list of your medications already there, and you can make sure that the dosage, the frequency you get your medication is correct, select what pharmacy you want to go to, and then see what options are available to you. Other really great trusted resources are the Medicare Rights Center, which is a nonprofit organization that ARP partners with quite a bit in order to produce Medicare information, and they can also do some counseling. The other one, which I mentioned earlier, because this is on the back of your Medicare and U book, is the State Health Insurance Assistance Program. This is also where I got my start in Medicare. And so these programs are available in every state, DC, and US territory, and they provide free unbiased Medicare counseling. They are not an insurance company, they're not affiliated with any insurance company, it's actually through a federal grant. And they are there to help you enroll into Medicare Advantage plan, Part D plans, assistance program. They're truly there to help navigate you and your Medicare throughout your Medicare journey. And this is our Medicare landing page. It is going through an update. We now have an Ask ARP chat box where someone can ask them a question and they'll shoot out an answer. And not only can you ask the chat box Medicare questions, you can also ask it Social Security questions as well. And so that is a new feature that's on both the Medicare and Social Security landing page. Next, we have ARP Navigator. ARP Navigator is a really great resource. It is available to members only at this time. And we have 3 courses in there right now that pertains to Medicare. The first course that we launched was Medicare Initial Enrollment. Second, we have Making the Most of Medicare. And most recently, we have launched Medicare Open Enrollment. And so these are really great tools and resources for your employees to use to help navigate it. And so what they will do, they'll answer a couple of questions on where they're at in their Medicare journey. And from there, a course will populate based on what they answered. And if at any point in time throughout their Medicare journey, something changes, then they can go in and make edits and get an updated course to help guide them. This is also our Employer Resource Center. And you can just type in Medicare in the field and you get these really great tip sheets that are available to you. Also, we have this new Medicare landing infographics page. And the really great thing is not only is it available in English, it's also available in Spanish and Chinese. And we just got 9 new articles that are infographics that were posted here. So it has a really great information. Okay, so in conclusion, Medicare can be quite complex, and it is really important to understand what your options are, and also understanding your penalties or delaying what delaying your enrollment can mean for you financially. And please use the resources and tools that are listed to help provide not only your employees but yourself in order to navigate the complex world that is Medicare. And I will pass it on back to you, Ashley.
Thanks, Xavier. It took me a minute to get off of mute. While we take questions, I will read them in the Q&A. If you have them, please use the Q&A function. I will launch a live poll. If you can take a moment to go ahead and self-select, you should be able to see it in just a moment. And while we have our audience members who are tuning in, answering the live poll, Xavier, I want to thank you so much for your time today. And let's just get to our first question from Yvonne. If someone has VA benefits, do they still sign up for Medicare?
So this is a little more of a trickier question. So there are plenty of veterans who stick with VA benefits and don't worry about doing Medicare, enrolling in Medicare. With that being said, if you have TRICARE for life, then you are supposed to enroll into Medicare. And what I will do is if I can figure out where my mouse is, I will drop a link to an infographic that is designed for Medicare and in the military.
Excellent. Thank you, Xavier. And we have another common question that we get a lot from small business owners and employers is, what can we do as small business owners if our employees miss the enrollment deadline? Is there anything we can do to help that process along?
Yeah, so if for some reason someone misses their enrollment period, deadline is I hopefully they are still maybe covered under the employer for health insurance. That otherwise they're going to have to wait until January of the following year in order to enroll during that general enrollment period, which is January through March. And so that would be their time that they would be able to get back into Medicare. And most likely in that situation, they haven't enrolled. It has been a full 12 months, so there won't be a Part B penalty.
Another question, thank you, Xavier, that we hear often is, what are some of the biggest misconceptions around Medicare open enrollment?
Yeah, I think the biggest misconception is that I don't have to do anything, right? Even if you decide to stay in your plan, you still need to review your plan to make sure that all your medications are covered, make sure your providers are still accepting that plan, whether that be the pharmacy that you like to go to, or if the doctor is still in network for your Medicare Advantage plan. There's still stuff that you have to do, even if you decide to stay in that plan.
Excellent. So I heard that you still have to review your current benefits and make a decision whether you want to make a change or stay keep things as they are. So thank you so much, Xavier. Thank you for your time. Thank you all for tuning in. This session has been recorded. We will upload this recording and share it out for those who were able to attend and for those who registered but were not able to attend. You will have access to this information. You will have access to the slides. Xavier also does offer this training for different organizations. This is free of charge as well. So if you'd like to get in touch with us, please do so. You should have our same contact information from when you registered for the event. Xavier, I would like to thank you so much for your time for an informative session. This now officially marks the end of our Medicare education series for November 13th. I almost said 12th. If you would like to tune in, we will be back next Thursday, November 20th at 2 p.m. and again on December 11th at 2 p.m. If your question was not answered, please do let us know, and we hope to see you again. Thank you so much, and have a
Thank
great
you.
afternoon.